Hello, good people. Good morning, good afternoon, good evening, depending on where you are and when you're watching. Thanks for tuning into my video today. This is the final in a three-part series, really talking about my frustration with, quote, traditional medical systems. The first video featured an excerpt from a video by Dr. Mike Warshawski on his YouTube channel, where he talked about looking at the whole patient and not just the symptom, not just the particular symptom in front of you, and how important that was because a gentleman came in with a foot infection and it ended up that he was in the middle of having a heart attack. And then in my second video, I talked about my experience for 4 years dealing with leg pain that prevented me from walking for more than 20 feet. I had 4 surgeries, 2 hip arthroscopies, nerve decompression in my back, and then another nerve surgery in the front of my thigh. Of course, none of them helped the pain whatsoever because they never diagnosed what was actually causing the pain, which was a blocked artery. And once I had the angioplasty and had the stents put in, which was a relatively minor procedure compared to, certainly compared to the 2 hip arthroscopies, and all of a sudden I could walk as far as I wanted with no pain whatsoever. And the vascular surgeon asked me, her first question to me was, why haven't you had a vascular workup before? Because this is classic claudication. And I know doctors will tell us, that insurance companies are concerned about how many tests they run and, yada, 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 cost containment kind of thing. Well, let's look at it this way. Those 4 surgeries that I had, chasing the leg pain, which were totally off base, had a price tag of over $130,000. $130,000. I'm not a medical actuary, but I can guarantee you a CT scan of the abdomen that would have shown the blocked artery would have been well under $130,000. Tenfold, probably, if not more. So that's the problem when they don't do a thorough analysis or a thorough diagnostics, thorough diagnostic. You end up down a rabbit hole and causing the patient just immense pain and suffering with the recoveries from those surgeries, costing the health insurance companies, $130,000. It doesn't make sense to me. Now, currently, I am dealing with some extraordinary back pain. It has been getting worse and worse and worse over the past 17, 18 months. So far in my traditional healthcare network, I've had things like, well, here are some exercises, here are some stretches, use a heating pad, use ibuprofen, exercise, make sure you get exercise, and the pain just keeps getting worse and worse and worse to the point in the first week in December for 3 days in a row, Thursday, Friday, Saturday. By the time I went to bed, it was all I could do to not commit suicide. It hurt that bad, and it's not because of depression this time, because depression was well under control. It's due to complete exasperation over the pain. Fortunately, that finally that Sunday, the pain did relent some, and on Monday I had a ketamine infusion for my depression, and the ketamine infusion provides complete pain relief for 2.5 days. So it got me over that really bad spot. But then again, by that Thursday, I was back to excruciating pain. I checked with the health provider network that my insurance company contracts with, Urgent Care, and the doctor said, they haven't done any imaging of your back. You're having this extreme pain. You need to go to the emergency room. So I did go to the emergency room. It was stacked full of people, as you would expect. And they actually were taking people out of the lobby, out of the waiting area, to have tests done, and then go back and sit in the lobby waiting for a room to open up. And so that's what they did with me. They took me back for a CT scan from the lobby, and then after the CT scan was over, took me back to the lobby, and I sat with my driver. And then all of a sudden they came out with a wheelchair, and had taken a real interest in me, and took me back into a room and said that my previously known abdominal aortic aneurysm was getting larger, and it was showing inflammation, and that they were concerned about it. So of course then I became kind of a priority, and they got the leads on me for my heart, and et cetera, et cetera. Then began giving me pain medicine for the pains that I was having, and said that the vascular surgeon was in surgery, and that he would be down as soon as he was done. So he came in and examined me, and felt the aneurysm pulsing, very painful to me, pulsing through my abdominal wall, and said that they were going to admit me and keep me prepared for surgery. He explained that my aneurysm was difficult because of my aorta's shape and various things, so I couldn't have a stent put in, that they would have to actually open me up and do a graft inside. And so the first order of business was to get my blood pressure down. It wasn't high, it was high normal, but given the state of my aorta, they decided that my blood pressure needed to be kept low in order to avoid a rupture of the aneurysm. Then on that Saturday, I was due to have surgery, and when the surgeon came in that had done my previous stents, she came in and we talked, and she said she wasn't convinced that the aneurysm is causing all of my pain. She thought that the chance of a rupture was low, and that if she did the surgery on me, that it would be months before I would be able to get any diagnostics as far as what was causing the pain. So she thought it was more important to focus on the pain angle, and just keep an eye on the aneurysm for the next few months. So that's what we did. I discharged. They couldn't get me in for an MRI of the back. I did call later, got in for the MRI of the back. There's nothing surgical with the back. So it's like, okay, so now we know I'm not going to have surgery on my back. So let's talk about this aneurysm, because I know it's causing pain. She's still not prepared to operate on it at this point. She doesn't believe it's causing all of my pain, and I think she's probably right, but I do know it's causing some pain. But to get to this point, to get to this point, I have already had, in February, I had bilateral hernia repair. So I had hernias in each inguinal canal. So they operated on those, no help with the pain. Then they decided that, maybe I had chronic epididymitis because the general surgeon had noted that my right testicle was atrophied, and on exam, my primary care physician said that he thought that this on the back of the testicle is something called an epididymis, and he thought that was the problem, so he was sending me to a specialist in the urology department. Long story short, I ended up having guys are going to love this, spermatic cord stripping, where they actually make an incision above the pubic bone, pull the cord out, and then separate everything inside the cord and cut the nerve, in theory, helping the pain. It didn't help the pain. So now I've already had these 2 surgeries at a cost of, I had it up here. So far, those 2 surgeries, $63,318, neither of which has helped with the pain. And that's where I've been. I've been to those 2, so I've been to the surgeon, general surgeon, and I've been to the urology specialist. I, on my own, made an appointment to go back and see the neurological surgeon, or the neurosurgeon that had operated on my back, against the wishes of my primary care physician. But that's where I'm at. I finally called Mayo Clinic. I had been there last year with some oral thrush issues. So I had checked in with them with their vascular surgery department. And they came back and said, yeah, they would see me. And 2 days after I made that call, they had my schedule ready for me for the end of February, starting on the 23rd. I will be there for 5 days. In those 5 days, I will have a CT angiogram of the chest and pelvis and abdomen. I will have other x-rays. I will have myriad blood tests, urine sample, etc., etc. And I will see a total of 7 surgeons, or 7 specialists, all in 5 days. And that's what's frustrating to me, that I can drive 3.5 hours, spend $450 or $500 on fuel and lodging and food and all that, be there for 5 days, and I know when I leave and I see Rochester, Minnesota in my rearview mirror, they will have done a comprehensive examination of everything in my body, and they will send me home with a treatment plan for my care providers back here. And it's very frustrating to me that a year and a half in to this, I'm not even halfway through what Mayo will get done in 5 days. Think of that. Think of that. Think of the cost and the cost of the surgeries that have done nothing. So there are networks out there that know how to do this, and that are able to do this in a fashion better than what I call a 1953 scheduling pattern. I'm curious now. I said that at the end of this I was going to ask for your participation. So I am curious now for you to put in the comments Let me know what your experiences are. Are your experiences more along the lines of the Dr. Mike, where you go to your doctor and they come in and they know your they've reviewed your medical history and they go through all these signs and symptoms and ask you things that you're not even there about, just to get a very good picture of where you're at with things, or have your experiences been more like mine, where you go in and they treat symptom by symptom by symptom and never really seem to work at connecting the dots? I realize that there are limitations with our traditional health networks, where they, for some reason, can't do what Mayo does, where Mayo looks at all the records from the past 3 years and says, we need this specialist and this specialist and this specialist and this specialist. Get them all together, find out from all of them what tests are going to be needed, get that all scheduled, and get you through it. I don't understand why these things can't be done in a more efficient manner in traditional health networks. I'm a year and a half into this. I'm not even halfway through what Mayo will get done in 5 days. Through my network here, I would probably be another year and a half. And considering that just a month ago I was ready to commit suicide over the pain, I don't know that I have another year and a half. So I'm curious. I'm curious what your experiences are. As I said, are you more familiar with the networks where they really do a good evaluation and get things going the first time, or are you in a network where it's a really piecemeal approach that takes an excessive amount of time to get things done? I'd appreciate hearing your comments on it. I'd appreciate hearing your comments about this video series in general. What you think about the presentations I'm making. There will be more videos about medicine in various different forms, but there will be videos on a whole host of topics. These videos are going to be whatever's on my mind at the moment, and I really hope that you'll give my video a thumbs up, subscribe to my channel, take an interest in at least seeing what's coming, because I guarantee you sooner or later I'm going to have a video that's going to have you saying yes, yes, yes. So thanks again. Thank you for joining me. Thank you for your feedback ahead of time. And until I see you next time, stay happy and stay healthy. Take care. Bye-bye.